Hey, everybody. This is Jeremy Sutton, host of the Healthy SBC Podcast, and I'm here with Alisha Timon today. We're going to be talking about the VitalOp Wellness app and just what all she does. So, Alicia, thank you so much for coming on the podcast.
Thank you so much for having me. I'm excited. I always love talking about health. So,
Good, good. We'll just kind of introduce, how you came to be part of the VitalOp Wellness app, your history, all that good stuff, and just tell us kind of a little bit about who you are.
awesome. Okay, so I am from Shreveport, Bossier all my life, lived here forever, and I've been a nurse, a registered nurse for over 20 years. Got out of nursing school, went straight into critical care. So I was in adult ICU for many years and saw that end of life, right? The sickest of the sick, took care of some really, really crazy things in ICU. And there was a point in my nursing career that I knew that I wanted to do something a little different. And I got to a point where I kind of got sick and tired of being sick and tired, to be honest with you, myself. I was not living a healthy lifestyle, working 12-hour shifts, and I was always tired and had chronic headaches. And, but it was because I was not fueling my body properly. I was eating candy bars and drinking Diet Cokes, and trying to save lives in the ICU. That's just the way it was. But I finally came to a point where I was like, gosh, I'm just sick and tired of being sick and tired all the time. And honestly opened a health and wellness clinic. That's a long story in itself, how that came about, but opened a health and wellness clinic and actually was my first patient. Totally and completely changed my lifestyle. And it was pretty amazing. I opened my clinic, Go Healthy, in 2003 and saw patients, 2013, and saw patients in my clinic for about 10 years. And it was just completely amazing. I saw chronic disease reversal and weight loss and just gave people hope that they really could take control of their health. And so I did that for 10 years and was introduced to Mandy Crow, Dr. Mandy Crow, who I know you know. She's
Yeah,
amazing.
absolutely.
And we are very like-minded. She actually did a talk on obesity, and one of my patients had tagged me in it. And so I went and I was like, I'm gonna go see what this doctor has to say about obesity, because no doctors really ever talk about obesity, right? And so I went, and everything she was saying was just everything that I preached to my patients for the last 10 years. And so I stayed after the talk, and we just became, instant friends, and decided, look, how can we get this message out to the masses? We were helping people in our individual clinics reverse chronic disease and change their blood work for the better and lose weight and really have a better quality of life instead of just managing disease. And that's how VitalOp was born. And so we said, the way to get this out to the masses is technology, because technology, we can get it out to tons of people. And so that's essentially how VitalOp started, is just two like-minded individuals in the medical field that wanted to make a difference.
Yeah, I love that. I 100% agree with you with Dr. Crow. She's amazing. And I feel like as soon as I met her, I became her friend immediately.
I
Uh,
think that's everybody with her.
I think so. And it's funny because she's texted me different things and um not and she shared posts on Facebook of things, and that's really the only time I've ever interacted with her at all was that one time that I interviewed her. But she's just amazing. So I'm glad that the two of y'all crossed paths. So when you talk about, and I know you had your business for 10 years and you were helping people get healthy and lose weight, and why do you think it's important now to not only continue that but to start with a my brain can't work with an app, with something with technology, and kind of go into that route?
Well, like I said, everybody needs what we teach,
Right.
and it's impossible to get it to everybody one-on-one, right? We can only see so many patients in our clinic, and we can only spread ourselves as thin as we can spread ourselves, right? So VitalOp, the app, the way we did the app and pre-recorded all the content for it and personalized the content or customized it for specific needs for different users, is just a way for us to teach people the missing piece to the current medical system. There's a big gap. I realized when I was in the hospital that we don't teach health. We don't help people get healthy. We manage their disease, right? And we just kind of put a put a Band-Aid on them enough to get them out of the hospital. We don't fix, most of the time, we don't fix what's going on. We just get them better enough to get them on the medications they need to prolong their life. People these days are living longer, but the quality of life is not better. So, we have all these wonderful, technology and drugs that keep, coming up and coming up, but people just aren't getting better. And so VitalOp is it's just a way for us to tell people, hey, you can be in the driver's seat for your health. Health is your responsibility. It's not your doctor's responsibility.
Ooh, I will fall out of my chair on that one.
Health happens every single day in your home, not the 5 to 7 minutes that you sit down at a doctor's office and talk to your physician, right? You can't find health at the doctor's office in 5 to 7 minutes. It's every single day with the actions that you take. And that's what we teach on our app.
I love that. I've been a PT for 15 years, and I don't have to have that conversation a lot. Well, I guess I have had to have that conversation a lot, but sometimes when it just gets down to the point where you can tell someone's not really trying or they're not taking it seriously, and then I'll have that conversation and say, look, it is not my responsibility to get you better. I will show you what to do because I know you're not educated on how the body works and things like that. But once I show you what to do, it's your responsibility.
Well, right. And I'm not going to work harder for your health than you are, right? And
Yeah.
that's what I used to tell my patients. I'm not going to work harder to get you better than you should. But with that being said, it's heartbreaking that the current medical system has crippled patients in thinking that the medical system should take care of them. The medical system should do all that. Well, guess what? Doctors don't get educated on health in med school. They
Yeah.
don't get educated on nutrition in med school. They get educated on disease processes, and how to treat those disease processes. And so we've got to teach people that they can be in control, and it can be very simple. What VitalOp wants to do is bring simplicity back to health. We have made it so complicated, and there's so much noise in the health and wellness industry that people get overwhelmed. They're like, what diet should I be on? Or what exercise should I do? Or whatever. We just want people to eat real food and move more.
Yeah.
Like, simple.
Yeah. It really is. It's funny because I was talking to Dr. Crow and I said, I'd lost like 40 pounds last year, the year before,
Awesome.
and because I'd stopped eating sugar and just any kind of grains and whatever. And I think I've gained and lost the same 20 pounds 3 times at this point because
Which is common. It's very
it
common.
is. But I was telling her how more clear I could think and how much more creative I had become. And she said it's because you weren't eating sugar.
Yeah.
And I hadn't even put it together, Alicia. And as soon as she said that, I was like, yeah, absolutely, you're right. I wasn't eating junk. And so
People
you
don't
think,
realize the difference that it can make, just making little changes. I had patients come in who couldn't even step up on a scale that was just a couple of inches off the ground because they were so arthritic. Their joints were so inflamed, and they had arthritis so bad. And then after the first week or two after we made some changes in their diet, they were like, oh my gosh, I can't believe this. I can climb back up the stairs at my home and all the things, or my acid reflux is gone. I haven't, experienced that in 20 years. I'm
right,
like, I know, it's just amazing.
my mental health is better.
Yes, yes. And I can think better and sleep better and all the things. I changed the way I ate when I was 36. So I ate total junk until I was 36 years old. Not kidding you. And I'm 47 now, and I feel so much better than I did in my 20s and 30s when I was constantly filling my body with junk, and it's great. I would never ever go back to the way I used to live my life.
Yeah. I mean, I want to go back to something you said where, you talked about doctors don't get educated on nutrition and health. And that is not a jab at doctors. And
Absolutely not.
but,
Absolutely
but
not.
it's the truth. And thank God they get, educated on disease processes because we need to know what to do because I don't know what to do with everything, obviously, as a PT, but it's okay to say, hey, we didn't get this education, but now we need other people to step in and start to educate the public on this And then don't be
Mhm.
scared about it. Because as a PT, somebody will say, well, you shouldn't be talking about nutrition. You didn't learn about that. Well, I mean, I actually did at Louisiana Tech in my bachelor's degree. I learned about nutrition. But if I know, I mean, it's okay to talk about this stuff.
Absolutely.
I'm not going to
Absolutely.
get sued because I told you not to eat a Butterfinger. I mean,
No, absolutely not. Now, there are certain laws in the state
right,
of Louisiana where you can't put someone on a specific diet with measurements and eat this amount and all that. As a registered nurse, I am legally able to give nutrition advice in the state of Louisiana.
okay,
But not everybody is. But guiding people to healthier lifestyle choices is not necessarily, making a diagnosis of,
right,
or whatever,
yeah,
prescribing them a certain diet. But that's what we do with VitalOp. We guide people on lifestyle choices that they can make that are simple, that are not only good for prevention of chronic disease, but reversal of chronic disease and cognitive health and dementia prevention, all of the things that really nobody in the current health system, we call it the sick care system because it's not the healthcare system, it's the sick care system, but nobody really talks about, right? That's just not something, I mean, maybe it's mentioned here or there, or you see a poster on the wall or whatever, but we just don't provide patients with the education, guidance, and accountability that they need.
right,
And so that's what VitalOp is trying to do for people, is provide them with evidence-based. It's not Alicia and Mandy's opinions on the app. It's evidence-based information. So everything is documented with studies and quality studies.
right.
I say you have to be careful where you get your information from. But yeah, so it's just great. And it's heartbreaking with physicians too. They don't have time to teach you about health.
Right. That's what I was
They
going to say. We just don't have time.
no, absolutely. They're constantly, seeing more and more patients and doctors care. They want you to be healthy, but they can sit and talk to you about being healthy for an hour, and guess how much they get paid for that?
Nothing. Yeah, absolutely nothing. Yeah,
No.
because it doesn't
And
matter.
it's
That's not a code.
it's no, there's no ICD-10 code for, hey, I talked about health for an hour. But it's just difficult. And so we have to make people aware that you have to have control of your health
Yeah.
and not depend on somebody else for that.
Yeah, absolutely. I was talking to Saturday. My wife and I went and we interviewed doctors Natalia and Vicky Larguise in Shreveport, and they do concierge medicine like Dr. Crow and
Oh yeah, I saw that. I saw
yeah,
your post about
and they
it.
were wonderful. But that was one of the things we talked about was Dr. Natalia did a rural healthcare in Hempfield, Texas for I think 7 years because she said she was a not a locally trained, not a nationally trained doctor when she came into the States. And she said she would see 35 people sometimes in a day. Well, you don't have time to talk about health. You can't
Absolutely.
talk to every patient for an hour, 35
Yeah, you
people.
have to focus on the problem that they came in for and fixing that, or really honestly just putting a Band-Aid on it.
Absolutely.
It's fixing it's not really the
Yeah. And that's why, VitalOp Wellness, that's why y'all's dementia testing that you have is so for lack of a better word, vital for the
yeah,
public.
absolutely.
And I want to talk too about what you said about the research because when I came to Dr. Crow's office, she showed me all of the research, all of the uh, Excel files, everything that y'all put into this app. So I got to see all the back end stuff, which made my head explode because it was so much. And so you've turned all that into this amazing app that you can get on your phone. It's just so cool. Talk about how people can get the app or learn more about it.
So it's super easy. They can go to vitalopwellness.com. That's our website, and it's VITALOP, vitalopwellness.com. And it will explain, there's a spot on there you can click to download. So our app is in the iOS and Android stores. So it's in both of the app stores, and it's $9.99 a month. So, that's a small price to pay for your health, is $9.99 a month, and you can cancel anytime. So you're not stuck with it for a year. But the deal is I have several of my friends that are using the app, and I tell them, look, let this be a habit. So it's video based, and depending on questions that you answer at the beginning, health questions, it puts you on a wellness journey. And that wellness journey might be prevention or high blood pressure or diabetes, all the, different types of chronic diseases. And it's video based, so we give pushed content to you every day. So you'll get Alicia and Mandy, you'll get sick of seeing us because we're always talking. But we also have recipes and articles that we'll send. But you get this push content every morning. And I tell people, you know what, just hit play and listen to it on the way to work. It's like a 3 or 4 minute video, but it sets the tone for the day. You know, this world makes it really, really easy to be unhealthy. You drive down Uri Drive and do you see health?
No.
No. So if you can put this health message that we have for you in your mind early in the morning, maybe when you're getting ready for the day or whatever it is, that kind of sets the tone for the day. It gets you thinking, okay, this is what I'm going to do today. I'm going to make this one small change. And then you create that habit and make it a true lifestyle change, and then add another habit later. You know, you don't have to turn your whole life upside down and like, I can't do this, and then just quit, right? Because we're so used to doing so many unhealthy things that take baby steps, just make it simple.
Yeah, absolutely. I was listening to Limitless today, and one of the things he says is inch by inch is a cinch, and yard by yard is hard. And
Yeah.
we try to
Yeah.
do too much. I'm
Yeah.
an all in kind of person if I start something. So like
Me too.
my wife and I lifted weights, I think every day last week, and then so this week it hadn't been so much. But it's like if I'm gonna run, I want to run 10 miles today, and then tomorrow I can't walk, and then I
Right.
can't run again for a year. And
Yeah.
so, but we got to take little baby steps. And so, something like simple as the VitalOp app is something super easy that somebody can do. So I know you push the content daily. You
Mhm.
said you go on a wellness journey. So when they get the app, they come in, they do all the testing, and then that sets them up for the future, correct?
Yeah, so we're just going to ask some medical questions. All of that is private. Nobody sees those answers, not even we do. You know, it's all within the app. But you just ask. We ask some medical questions, and then it puts you kind of on a specific journey customized to you. But then you also have access to hundreds of healthy recipes. You have access to food lists. You know, everybody's like, well, what do I eat to be
Right.
healthy? Well, we have food lists for you. And it's not an all-encompassing food list, but it's just a guide for you. You can print those out and put them on your refrigerator. We even have a food list of things to avoid or to limit, you know, when you do have those things. I know we're in Louisiana, so you know, it is what it is, and food is our culture. But unfortunately, in Louisiana, our culture is killing us.
Oh,
And
absolutely.
we have to realize that with statistics. And so the statistics of chronic disease continue to rise. And if we just make these little bitty changes here and there, we can make a huge difference. And in the app also, we have a health record where I always tell patients, and Mandy always talks to people like and tells them, look, you need to be in control of your health information. So um, you know, we have gastrointestinal specialists, and then we have Krista Shumpert, and we have all these different health entities in town, and they don't all talk to each other. So, you know, you go one place and they don't have the information for this place. And when was this last test? And so many things are repeated and unnecessary charges are done. So we have a health record in there where you can input all your health information and update it as it goes along, which is really nice. And then there's a button you can hit and you can print it out. So before you go to any doctor's office, you can take that with you and say, here's all my information. It makes it super easy. There's reminders. I know there's reminders, and your doctor will absolutely love you if you bring that to them
Yeah.
because it makes it so easy for them. But there's reminders in there. I've got one set on my phone. It reminds me every hour from 7 a to 7 p to drink water because that's so important. And reminders for when your colonoscopy is, you know, you can put all kinds of different things in there. So it's just really an all-encompassing health app. And when I mean health app, giving you back the control to guide you on what you need to do.
Good. I love that. I think I'm the only person on the planet that doesn't have to have a colonoscopy in the next few years. So I'm not excited about that. Anyway, but moving on. I love what you talked about with being able to print everything out because I was just talking to the speech therapist. Right now I've got Healthy SBC. I'm growing that, but I also do full-time home health. And we have a patient that we see, and we're the only two medical professionals that she sees during the week, other than when she has doctor's appointments. And there's a lot of stuff that we see and we tell the nurses, they call the doctor, but if we could just sit down with all seven of her doctors, because I think she may have more than that because there may
Yeah.
be Parkinson's, there's dementia,
Yeah.
acid reflux or whatever all's going on. If we could just sit down with all of those doctors for 30 minutes and have a conversation about this one person, how much
And,
better would their healthcare be? But you can't.
and it's not happening. Yeah, you're not having a roundtable discussion with it.
No,
Yeah, and that's a big deal about our medical system. It's just so broken like that, And so we have one hand doing one thing and one doing the other. But here's the deal: we don't want you to get less care. We want you to need less
that's right.
care. And so if you take control of your health and you make these little changes, you won't have so many doctors and you won't have, I know everything is not in our control. I completely understand that. But so many of the disease processes that you're seeing in your patients, that I saw in my patients, they're self-inflicted
Yeah.
and they are in our control. And it's crazy because this day and age, even like all the commercials that we see on TV, right, for all the drugs and all that stuff, it makes us think that we're really not in control and we just need a pill to fix things. No, we just need to take control of our lifestyle and make these little bitty changes that are very simple.
Well, I'm not going to mention the drug that everybody's currently taking to lose
Yeah.
weight. I don't want to get torched because I know several people taking it.
Oh,
But
I do too.
and if you're taking it and you're listening, I'm sorry, I'm not being a jerk. But we can 100% control obesity and diabetes, 100%,
Type 2
and
diabetes.
reverse both of those.
Type 2 diabetes is a dietary disease. You eat your way into it and you can eat your way out of it.
That's right.
And I can say that with 100% confidence because the 10
Absolutely.
years in my clinic, I had patients come in who had been diabetics for 20 years. I had type 2 diabetics come in on insulin. They were off of their insulin after a week, in my clinic. They were reversing their diabetes numbers. I mean, getting rid of all their drugs. And listen to this. This is what was sad is nobody ever told them that that was possible.
Mm,
Nobody ever gave them hope that they could do that.
I believe it.
And it just blows my mind, like it's crazy.
And Alicia, I honestly feel like that goes back to the we don't have time again. I interviewed another direct primary care doctor a few years ago when I had the Servant PT podcast back then. And he said that, they would come in and prop their leg up on the wall when they talk to a patient. And they would say, hey, when that leg gets tired and you need to switch legs, it's time to walk out of the room. He told me that in medical school. And I don't know, I don't remember where he went, but he said that I'm not lying. This is actually what we were told. And when I was in PT school 15 years ago, one of the studies we read was the average doctor's a visit is 2 to 3 minutes.
Oh,
And
absolutely.
I don't feel like
It's
that's
scary.
gone up any. So we just don't have time as medical professionals, even though we want to have time, which is why I think I'm such a proponent of direct primary care doctors and concierge medicine and all that, because you get to spend the time because you're seeing less people and you're not having insurance tell you what you can and can't do.
Right. Well, and even the education that I provided as a registered nurse in the hospital, it wasn't educating the patient on how to get better. It was educating them on their medications or how to change their dressing or, things like that. It's not how to get rid of the acid reflux or how to,
Right.
lower your blood sugars. It was give yourself this much insulin when you
That's
eat this
structure.
many carbs.
Yeah. That's because the ship is sinking and we just have to plug the hole. We don't have time to.
Yeah, yeah, yeah. It's
Um,
crazy.
I love that. So, say it one more time. I like to do like a healthy SBC spotlight. I know you already gave the website, but just tell again the website where people can go to find out more about this and all that.
Absolutely. It's vitalopwellness.com, and that's VITAL because it's vital for your health and vital for your life. vitalopwellness.com. And that will give you the information on the app and also, which is in both app stores and the dementia prevention plan. And we have some things coming in the future, so stay tuned.
Yeah.
We're working on a lot of things. We've already been in talks with the Louisiana Department of Health down in Baton Rouge. And
Yeah.
so I'm sure you've seen our post on that. So
That's right.
we're
Yeah.
hopefully we're trying to shake the apple cart upside down and really promote wellness in the state so we can be a leader in that aspect instead of at the bottom of the barrel.
Yeah. We need it 100% because,
We do.
gosh, we need to turn this around if we can. And we can. We can.
We can, absolutely
All
can.
right. You get one final minute to talk about whatever you want, professional or personal. Go.
Oh gosh. Well, I just want to encourage everybody that you can make a difference in your health. You can change not only your health, but the health of your family tree. And remember, parents, kids are watching you, right? And we need to lead by example. And so I think that that we just want to empower you to make those changes and encourage you that it's totally possible, and that just because you have a family history of certain things doesn't necessarily mean that it's your destiny.
Ooh, that's powerful stuff. I love that. Alicia, thank you so much for coming on the podcast. It was great to learn more about y'all's app.
You're welcome. Thank you for having me.